Hello everyone, welcome back to my YouTube channel. So today we are going to talk about the liver abscess. ये एक बहुत ही important topic है. See, it is a serious condition when it is undiagnosed. Okay, once it is diagnosed, it is easy to treat this condition. Okay, so first of all, let's understand what is liver abscess. The definition is, it is the localized collection of pus in the liver due to infection. So basically we have liver organ. So when there is a collection of the pus there, localized collection of pus there, that is called as liver abscess. Okay, so now let's understand everything about this, the causes, types, clinical features, management, everything. Okay, so there are two types of liver abscess based on the causes, based on the etiology. Okay, so the number one is pyogenic. I'll write LA for liver abscess. Okay, and number two is amoebic liver abscess. So there are two types. One is pyogenic liver abscess and the second one is amoebic liver abscess. See, as the name suggests, so the pyogenic liver abscess is caused due to bacteria. It is caused due to bacteria. And the amoebic liver abscess is caused due to protozoan parasite. It is caused due to bacteria and it is caused due to a protozoa. Now let's understand it deeply. So it is very easy जब हम इसे differentiate करके पढ़ेंगे. So it is basically like you can say it is like opposite to each other. Okay. So now let's move on to the next. So now let's understand it in a differential form. Okay. So first is pyogenic. First let's start from causes. Okay, I said the pyogenic liver abscess is caused due to a bacteria, right? Bacteria. So now let's understand which type of bacteria. So it is caused due to E. coli, Klebsiella, Streptococcus, like that kind of bacteria. Okay, and the amoebic liver abscess, it is caused due to a protozoan parasite, that is Entamoeba histolytica. Okay, so these are the causes. Okay, next is why it is caused. Number one is the bacterial one is, it is caused due to a bacterial infection, as I said. So basically it can be due to like hematogenous spread हो सकता है, that is blood is flowing through all the organs, right? When the infection is present in the blood and when it reaches to the liver, there it can like leave the infection, and then that can lead to the liver abscess. And appendicitis, diverticulitis, these kind of infection can spread to the liver through blood circulation, through that is called as hematogenous spread through blood. Okay, and coming on to the amoebic abscess, it is caused due to, see, you might have heard about amoebic dysentery, right? So the person will have this infection that is Entamoeba histolytica will be present in the intestines. It enters the body through contaminated water, poor sanitation and all. Okay, so it will be present in the intestine. Through portal vein, it will spread to the liver. Okay, like that it will enter the liver. This is how the infection enters the liver. Okay, so coming on next is the clinical features. Okay, clinical features. Let's understand its onset. So here the onset will be gradual or sudden onset. Like suddenly the symptoms will appear. But in amoebiasis the symptoms will be insidious. मतलब the symptoms इसमें सिवियर नहीं होंगे, ठीक है, माइल्ड सिम्टम्स होंगे, बट प्रोलॉन्ग्ड इसमें होंगे, प्रोलॉन्ग ड्यूरेशन में होंगे. ठीक है, नेक्स्ट लेट्स टॉक अबाउट द सिम्टम्स. ओके, दिस द फर्स्ट वन इज फीवर, राइट? फीवर. Here there will be high fever. in which bacteria. हमेशा याद रखें, bacterial infection will lead to usually high fever. Okay, high fever will be there with chills and rigors here. But in the amoebic liver abscess, the fever will be here severe, here moderate. Okay, then coming on to the pain. अब एक इतना बड़ा पस की अब इतनी बड़ी पस की कैविटी है तो person will experience pain, right? So where will be the pain present? See, our abdomen is divided into, I'll draw here, then I'll rub. Okay, our abdomen, imagine this as our abdomen. Okay, so it is divided into 9 quadrants, right? Anatomically, this is umbilicus. So here it is, this region is called as right hypochondriac region. Right hypochondriac region. So here the liver is present. Okay, so a person will experience pain in the right upper quadrant. Right upper quadrant, that is here. I'll add the picture for your understanding. Okay, so in both the cases there will be pain, but in pyogenic, that is bacterial, the pain will be more and pain will radiate to the shoulder. Okay, next, fever is done, pain is done. This one I'll draw. So coming on to type of abscess. In both the cases abscess will be present. Okay, in pyogenic also, in amoebic also. But in amoebic the abscess will be single. एक ही abscess होगा, single abscess in the liver. Okay, here single abscess. But in pyogenic, that is bacterial, the abscess will be multiple. You can remember it like PM, Prime Minister, PM. You can remember it like PM. Okay, then that is pyogenic and the abscess are multiple. Okay, so next is the pus, right? The pus will be different, right? So in a pyogenic liver abscess, the pus will be yellow or green, and it will have a foul smell in it. Coming on to the amoebic liver abscess, the pus will be, in medically we call this Anchovy sauce. Anchovy, I'll write it here. Anchovy sauce. So what it actually means is, anchovy sauce means the pus will be chocolatey colored. I'll add the picture, okay, for your reference. The pus will be chocolatey in color. Okay, so this about the clinical features. And one more thing, in the amoebic liver abscess, the right lobe is mostly affected. Why? The right portal vein carries most of the blood there. So the right lobe is mostly affected. Right lobe is mostly affected here. Okay, in this also mostly the right lobe, but left lobe can also be affected in pyogenic. Okay, this is about the clinical features. Next is investigation. How will you investigate? First of all, you will do CBC, ESR. Those are like routine tests. Okay, those will show leukocytosis and increased WBC as the infection is present. That you can see. Then in the blood culture, if the bacteria is present, it will be positive in pyogenic. In amoebic, we go for the stool culture. In a stool culture, we can see the eggs of the parasite. Okay, so, and then till now we studied what? We studied the it is the definition, right? We studied definition. What is the definition? The localized collection of pus in the liver is called as liver abscess. There are two types, pyogenic and amoebic liver abscess. Pyogenic is caused due to E. coli, Shigella, Streptococcus, like that bacteria, and it is caused due to a parasite, that is Entamoeba histolytica. Next, coming on to the clinical features we discussed, right? So the most important clinical features in pyogenic, that is bacterial. Imagine bacteria as a severe and amoebiasis as moderate. Okay, this bacterial pyogenic liver abscess, the fever will be high with chills, rigors, and the abscesses were in pyogenic, the abscesses were multiple, that is PM I told you, and in amoebic the abscess was single, right? And the pus yellowish green in the pyogenic and foul smelling, and in the amoebic we had Anchovy type of pus. And then right lobe was mostly affected in the amoebic. In this also right lobe, but left lobe can be affected in the pyogenic, right? Then so then one more thing, in the amoebic liver abscess, the patient will give you the history of diarrhea or dysentery in the past, okay? Because I told you, so the amoebic liver abscess caused due to this one, Entamoeba histolytica came to the liver from intestine. So he had the amoebic dysentery in the past, है ना? intestine में होगा तो dysentery या diarrhea की history वो देगा ही देगा patient. Okay, next coming on to the management. Next is management, right? So I'll rub it. So coming on to the management, in the pyogenic it was the abscesses were multiple. In here the abscess was single, है ना? So in this, coming on to the management, in the amoebic we give this reacts well to metronidazole. It is a drug, that is a anti-parasitic drug. We give that, and it usually patient reacts very well to it. But if the abscess is more than 6 mm, or if there is a risk of rupture, then we also do percutaneous drainage, okay? But usually we don't go for the drainage here. Patient reacts well to this drug. But coming on to the pyogenic, as it was caused due to bacteria, what we will give in the treatment? Broad spectrum antibiotics. Broad spectrum antibiotics. And this most of the time this requires drainage, so we go for percutaneous drainage. Then the symptoms will subside. Life threatening when it is undiagnosed, okay? But once it is diagnosed, like हम आसानी से इसे treat कर सकते हैं. So if anybody is complaining of chronic right hypochondriac pain, dysentery, diarrhea, so just look for it, okay? And CT or ultra USG guided aspiration we do. We scan the liver, we see where it is actually located, then we just drain it and we give the drugs accordingly. So yeah, that was it about the liver abscess. It is a short and easy topic, and I hope you understood the topic. So yeah, if you like the video, please do like, share and comment, and don't forget to subscribe our channel, and see you in the next video. Bye bye, take care.